COVID-19 has impacted our communities and ravaged through our historically marginalized communities of color the most, with an overwhelming amount of deaths. Just here in Contra Costa County, we have experienced over 700 deaths to our county. And yet we still continue to see some inequities around vaccination efforts. When you look at data that compares different groups and minorities, I'll just point out that here in Contra Costa, we've vaccinated over 15,578 African Americans. In contrast, we have vaccinated over 126,280 white Caucasians in our county. Huge contrast. It shows us that we really have a lot to work on here. We really need to open up more access and provide more community education. Through our mobile vaccination efforts, we have been successful in vaccinating over 35,000 folks within our community. These mobile vaccine units are really trying to get into communities that have historically been underrepresented. We really want to make an effort to build an infrastructure to bring vaccine to our communities. This vaccination effort is really about trust. It's about how we establish trust within our community members, our residents, our patients, and our community and staff. We cannot neglect the fact that there has been multi-generational trauma by the hands of the government for historically marginalized communities. And we need to acknowledge that fact, and we really need to work on trust. Our community, we work at the speed of trust. And so we need to do everything. There is no silver bullet for this. We need to try all of our efforts to reach our communities, to establish that trust. You say vaccine hesitancy, I say let's build trust. I refuse to use vaccine hesitancy as part of my statements, because if you call it vaccine hesitancy, you're leaving it all up to the community, and you're not really owning what's behind that vaccine hesitancy. Let's dig a little deeper. I would like to introduce Dr. Rohan Radhakrishna, one of our deputy health officers and leaders within our organization at Contra Costa Health Services. He has been with us for over 10 years. So thank you for joining us this morning. We wanted to jump right into some common myths and some general information about the vaccine itself. I personally have experienced having the vaccine. I was vaccinated a month ago, and my own personal experience leading up to it, I had some questions. I had a lot of questions. How will it affect me? How will it affect my body? One of the things that was really helpful for me was to understand what was inside of the ingredients, understanding also what some of those side effects might be. What I found, coming in, I had some anxiety around it. Obviously, this is the first time. It's reminded me of the first time when I got my flu shot. And my experience after my first shot was that I did feel a bit fatigued for a few days. I did feel some soreness in my arm, but after about 36 hours, it was like nothing had ever happened. I went right back to doing the same things I was doing. And in between shots, I think that was another stressor, because you're waiting on your next shot. And for me, I was thinking about that and thinking, wow, there's people are actually talking about the second shot being worse, and it might be, having other kinds of side effects. So I had to experience that. I went through some of the anxieties there, but it was straightforward. The second shot actually had zero effect on me. I went right back to working, the same day, as a matter of fact, and I feel great. I haven't had any side effects. I'm very excited that I can see family and I can visit family that, are susceptible and have a higher rate of mortality around COVID-19. I'm very excited that I can be around others and travel and start thinking about different ways to get back to some new form of normal. So I'm excited about some of those things around the vaccine. How about you, Dr. Rohan?
It's amazing that in less than a year since this pandemic started, we received the gift of an offensive tool to fight this virus, which was a vaccine. To get it in December of 2020 was beyond my dreams. And me, as well as many frontline providers, nurses, doctors, therapists, were also a little afraid and had some questions and concerns. And I want to normalize that. It shows that you care about your body, that you are asking questions and you do have concerns. And the good news is there's been millions in people's arms and we're monitoring it closely. And I can share my own story that I did have a little redness and some petechia or bruises around the site, but that went away in a day or two. My wife, who's also a healthcare provider, actually had a more serious impact of feeling like she had a bad cold and was in bed kind of shaken and not feeling so great for a day. But then she bounced back and was back to normal. And I have this conversation every day with my patients, whether they're concerned about getting the flu vaccine or a tetanus booster or a varicella vaccine to prevent zoster. And it's an ongoing conversation. And I tell people it's like going to the gym. No pain, no gain. The good thing is it's a little bit of pain and only lasts a few hours and it's mild, right? It's strengthening your immune system. And those side effects are actually a sign that your body's working. It's learning, it's building that immune memory to fight back. So don't be afraid. What we know is now that we've given tens of thousands of those vaccines, we've had 0 serious adverse events and 0 deaths, but we've had tens of thousands of cases of COVID and hundreds of deaths. So we got to do the math for ourselves. The risk is a personal thing, but I'm grateful that I've been able to get the vaccine. And I encourage each one of my patients to as well.
Well, thank you for that experience and for sharing. I wanted to, the next thing I wanted to talk about was there's a lot of conversations happening now that we have the new Johnson & Johnson vaccine, the Johnson vaccine that's available. It's a single dose. And there's a lot of conversations about the efficacy of vaccines. And I wanted you to help us all define what that means in layman's terms. What is efficacy? And how do the vaccines compare to each other in efficacy?
Efficacy is a fancy word which simply means the ability to meet a goal. The goal is to not end up in a grave, to not end up in an intensive care unit on a breathing machine, or to even go to the hospital. And for that, all the vaccines are almost 100% effective. It gives you the protection to fight off the infection, but there are minor differences in the rates of getting the infection with mild symptoms. You can't actually compare them because there weren't any head-to-head trials. We're moving fast to get vaccines in people's arms, and they were also studied at different times during the pandemic, in different geographic places during the pandemic, with different variants circulating. So we can't compare them directly. The best vaccine for you is the one that's offered to you on the day of your shot, when it's your turn. So when you show up, the sooner we all get vaccinated, the sooner we can reach community immunity and save lives in our families and communities.
That's great to hear. Dr. Rohan, I appreciate that confirmation on that. I wholeheartedly agree with you. The best shot, the best vaccine is the one that gets into your arm today and vaccinates our community. Just in terms of answering a question, like if someone were to ask, is one vaccine better than the other? What's your response to that?
As mentioned, all vaccines are nearly equivalent and highly effective at preventing death and hospitalization, which is what our main goal is. They're all very effective, varies based on who you are, between 70 and 95% effective for getting the virus with symptoms. But if you get that in your arm, you can be assured you will never get sick enough to end up in a hospital or actually die from it. And that's the insurance that people want. There will be new vaccines rolling out. And as of now, the third one on the scene in the United States is the Johnson & Johnson, also known as the one and done. Each vaccine may have some differences and benefits and advantages. So for folks who are hard to reach, like someone leaving a hospital with transportation issues, someone in a detention facility, or maybe in and out of a homeless shelter, we want to catch people when we got them and maybe prioritize those one and done Johnson & Johnson vaccines for that population. So we can ensure choice. You know, just yesterday, I had a patient in clinic who is a Mexican grandmother, and she was so grateful that she got the vaccine in our clinic, but she was actually really sad that her relatives in Mexico, in Michoacan, were still at risk and dying because the vaccine hadn't rolled out there. So she was grateful to get what she has. And here in the United States, in California, in our county, we are blessed to have options, and people should take what they're offered because many other countries and places haven't even got the vaccines yet.
Dr. Radhakrishna, I'd like to ask you about the context of understanding clinical trials. There's a lot of questions around that and the outcomes on Black and Brown trial participants. We received many questions around this issue. How would you respond to that question?
Many aspects of society don't have enough representation from women or people of color. The same is true for science on the vaccine development side and for volunteers participating in clinical trials. But it's getting better. You should know that a Black woman was instrumental in the vaccine development for COVID, and many Black and Brown folks were involved in those trials. Was it enough? No. Is it getting better? Yes. Watching disparities take its toll on our people is playing defense. We can't live in the past. We must be the change we wish to see, and equity is about playing offense. It means signing up and joining those trials. And that's why the presidents of historically Black colleges, from Xavier and Dillard in Louisiana, all the way to the East Coast, rolled up their sleeves and themselves participated in the COVID trials early on. The presidents of Howard and Meharry Medical College are signing up their institutions to participate in ongoing trials. But you don't need to wait for those results if you have questions, because we don't have time to waste. We're doing real-world studies on the millions of Black and Brown people and women who continue to get the vaccine as we follow the safety and effectiveness data. So you can be more reassured than ever that it's not just dozens of people who have received it, but in the thousands to millions. Nobody is one statistic away from changing their mind. It's the heart, the stories, and the personal connections that change and inspire us. So I can tell you that the Moderna trial had 27% people of color in their trial participants and volunteers. But do your own research. Talk to people in your community who have gotten the vaccine and ask them how they feel a few months later. We learned this a decade ago with the H1N1 influenza pandemic. In the Black community, it was actually the moms that were the key. You can't come in my kitchen if you ain't had the vaccine. That goes a long ways. We want people to be a part of the solution. The technology in those first 2 approved vaccines is called mRNA, and the M stands for messenger. We want you to be a messenger, to share your story. And if you have doubts, that's okay. But talk to people who you trust in your family and community who have gotten the vaccine. That's what creates trust and change.
Thank you so much, Rohan. We appreciate your time. We will now turn it over to the audience where they will have some questions for us. Thank you for joining us. Today, we will be addressing mistrust in BIPOC communities due to medical racism. We have some great community members joining us today that will be talking about some of the questions that are really brought forth by our community members, members from our African American work groups, our Latino work groups, our historically marginalized communities work groups, our older adults work group, and our youth and young adults work group as well. We also have members from the first question comes from our African American work group. So I will hand it over to our community member.
We would like to know, how were COVID-19 clinical trials more ethical than the historic medical experimentation on African Americans?
We have a dark history that we have to be honest about, apologize for, and move forward from. And we're moving in that direction. In 1932, the US Public Health Service was supposed to conduct a 6-month syphilis experiment which instead became a 40-year experiment that harmed the health of Black men until 1972, violating ethics and decency. The damage has spanned generations and continues to harm the public's trust, whether it's in taking a blood pressure pill or a vaccine. We have to continue to apologize and acknowledge that racism has and still does exist in all aspects of healthcare. Implicit, explicit, internalized, externalized. We can do better, and we are. We have to separate that past from what's happening now. We have prior informed consent for all clinical trials as a value enshrined in some pillars of bioethics, the Helsinki Declaration, the Belmont Report, and what our Food and Drug Administration uses for all clinical trials. What that means is volunteers must fully understand the risks, the benefits, and the alternatives before their participation. This is required by the FDA. And unlike in the past, where there was secrecy and neglect, now we are inviting people with choice and with full prior knowledge to participate. If people of color want vaccines that are for us and by us, we're asking them to join in. That's why Black leaders, historically Black colleges, are having their own presidents participate in trials and signing up their institutions for new trials as we get more vaccines available that are safe and effective for all Americans, especially people of color.
Thank you, Rohan. I wanted to next introduce one of our members from our historically marginalized communities engagement work group, who has a question for Dr. Rohan as well.
Hi, my name is Juan Calderon. In the Latino community, there are beliefs that the vaccine was developed with fetal tissue and that the vaccine can give you COVID.
I've been a family doctor for 10 years in San Pablo West County Health Center, where 2/3 of my patients are monolingual Spanish-speaking patients. And I get lots of questions, concerns, myths, conspiracy theories for all vaccines, flu, tetanus, and now COVID. So these questions are important to answer head on. All of the COVID vaccines, like many new drugs in medicine, have used human stem cells for testing as part of the development process. I view these as gifts from God and science that are saving lives. We can't let perfect be the enemy of great. So talk to your religious leaders and make the best decision for your values. But let's not let our communities continue to suffer when we have the solutions in front of us. This is why we're participating and collaborating with many religious leaders of all faiths, including in the Latino community, to be the messengers and share their views on what's safe. It's common to think that if you're a little sore or have some mild side effects that you may have gotten gripe or the flu or COVID from getting it. But like I say, it's like going to the gym. No pain, no gain. You're a little sore afterwards. That doesn't mean you got the virus or the disease. It means that your body is learning and fighting back and getting stronger. There's a big difference between getting a little headache or sore throat after a flu vaccine than getting slammed in bed with high fevers or ending up in the hospital. And the same is true for COVID. The side effects are very mild and short-lived, whereas the disease itself can be deadly and can have symptoms that last for months afterwards.
Our next question comes by way of our Latino work group.
Hello, I am Armando Mendoza, representing the COVID-19 Latino work group. And the question that we had is, with a recent example of the atrocities on migrant women at the border being given hysterectomies unknowingly, there is a layer of mistrust towards our government. And there's a conspiracy theory that the vaccine will inoculate minorities with experimental ingredients. How do we know we aren't being targeted yet again?
We have to come to terms with our dark past and present and apologize, but we can't let the bad actions of some stop us from saving our communities. Our nation was founded on horrific things that lead to mistrust that's understandable. The genocide of Native people, slavery of Africans, forced labor and servitude of migrants, the exclusion of Asians, and government and other actors continues to mistreat migrants and perpetuate harm against women and people of color. All I can do as a government worker and public health worker is to offer a sincere and profound apology for all of this and to ask for support and partnership to move forward. Fear and conspiracy theories can only be supplanted with apology, acknowledgement, love, and trust. So yes, we are hypocrites who have violated the Hippocratic oath to do no harm because we have caused harm and furthered racism and mistrust. What has been done cannot be undone, but we can apologize, look in the mirror, acknowledge the ongoing harm, bias, racism in our government and in our healthcare system, call it out, and move forward, which is what we have to do. So please forgive us. We are committed to a COVID-19 vaccine rollout that is ethical and equitable, and we will do our best to rebuild trust with all communities. What's more important than this shot in the arm is trust in the heart for the other public health emergencies on the horizon. We're sorry, we must do better, and we promise we will. One small step in that direction was in November of 2020. Our Board of Supervisors unanimously supported a declaration that racism itself is a public health emergency. And we hired a CEO, a Chief Equity Officer here with us today, Gilbert Salinas, who's here to ensure that we offer more than words, that there's action and accountability. I signed up as a health officer, and this is my badge. As an official, I took a promise to protect our residents from enemies, foreign and domestic. The foreign enemy in this case was a virus. The domestic enemy is ourselves, racism and misogyny against women and people of color. So we have to apologize and move forward, and we need you as our mensajeros and messengers to build that trust, which is why our community work groups, our faith leaders, our promotoras are essential to get facts over fears through conversations, through social media, because we can't let our community members die for our past mistakes.
Now we will take some time to answer the question, how do COVID-19 vaccines work? The first question comes by way of our Youth and Young Ambassadors work group.
Hi, my name is Jasmine Turner. I'm representing the COVID-19 Youth and Young Ambassadors work group. So our first question, how did scientists produce the COVID-19 vaccine so quickly? And how did they bypass the normal vaccine approval process? And then just in relation to that, are the new strains going to affect vaccine efficacy?
Operation Warp Speed to rapidly develop vaccines was successful thanks to millions of dollars of your taxpayer money and new technologies. So when it's your turn to get the vaccine, you better cash in, since it's your resources that helped it be a success. Was it rushed or did it take shortcuts? No. Will it protect you against variants? So far, it's looking promising that the approved vaccines are still very effective, including against variants. But it's a constant arms race. As viruses mutate, we may need to change our vaccines in coming years with boosters and future technology. The best way to stop these variants is to vaccinate as many people as soon as possible, so the virus can't even get a foothold to dance around in our communities and mutate. Here in Contra Costa County in the Bay Area, we were the first in the nation to implement the stay-at-home orders. And in less than a year, we went from fearing an unknown enemy and playing defense with masks and social distancing to playing offense and fighting back with shots and arms. I'm amazed at how fast we did it, but we did not cut corners. It had to be independently reviewed by many experts, starting nationally with the Food and Drug Administration. They gave an EUA, emergency use authorization, because the need was so great, the data was so compelling, and the safety had been ensured. Then Western states approved it, Then the California Governor's Panel of Experts approved it. And finally, in our county, our Committee on Ethical and Equitable Allocations agreed as well.
And our next question comes by way of our African American work group.
As part of the African American Health Conductor Program, I know that many would like to know, after killing the coronavirus, does the vaccine stay in your body and leave behind a template?
The vaccine actually doesn't kill the virus. It teaches you to make the antibodies to kill the virus so it doesn't land and spread in your respiratory system. Those mRNA messengers show us what the enemy looks like, and then we learn how to fight back.
We'll now be hearing a question from our Asian Pacific Islander work group.
Hello, my name is Sangeeta and I represent API group. And a question that I have is, after getting vaccinated, do you have to continue social distancing and masking because you can get COVID and pass it on to others?
Risk is a very personal thing. Who we live with, our own medical conditions, if we live with the elderly or high-risk workers, and people are getting vaccinated at different times. The federal guidance from the CDC is continuing to change on this. It's important to not let our guard down. Getting a vaccine isn't a golden ticket to be without masks in all settings. So similar prevention needs to guide our personal choices. To date, the data is showing that the vaccines are very effective, not only at preventing us from getting COVID, but also preventing us from passing it on to others. And this is great news, but we need to continue to study it. There may be variants, it may mutate and evolve, and not everybody is vaccinated. So we have a personal, a family, and a community responsibility to continue to play it safe. That means be outdoors rather than indoors if possible, have good ventilation, wear masks, especially if you're coming into contact with people who haven't yet had the vaccine or may be at higher risk from a chronic condition or age. We want to take care of our loved ones, and playing it safe is the best way to do so. We all have pandemic fatigue from these prevention measures, but it's the best thing we can do to make sure our loved ones continue to stay healthy and alive. So we can take more risks once we're 2 weeks after our final dose of the vaccine and we've built those antibodies, but we don't know how many months those antibodies last for or when we're going to need a booster. So err on the side of caution, follow the advice of your own personal physician, and continue to play it safe and care for your loved ones.
Thank you. I would like to thank all of our panelists and also our questions from our community members. Thank you for sharing the stage with us and sharing this time with us in space. We now have a question from our Asian Pacific Islander community.
Hello, my name is V. I'm with the API work group. In the Southeast Asian community, there is fear that the vaccine has ingredients that may cause infertility. Can you speak to this?
The vaccine does not and cannot cause infertility. To the contrary, it can actually help moms and babies survive if they get infected with COVID. While the vaccines weren't specifically studied in pregnant women, some of the women in the studies went on to get pregnant, proving that it didn't cause fertility. And also that once they were vaccinated, they had healthy moms and babies. Some of those women who didn't get the vaccine in the study actually had unhealthy moms and fetal demise. Being pregnant can lower your immune system and make you more likely to get really sick or die from any disease like the flu or COVID. That's why we want all pregnant moms to get vaccinated for the flu and COVID. The best gift you can give to your baby is fresh antibodies to protect them from an unknown enemy in the outside world. Are we seeing more infertility in modern times? Yes. Are we seeing more vaccines? Yes. Are they related? No. This is called true, and unrelated. Rising infertility and lower sperm counts isn't due to vaccine ingredients. It's due to chemicals in our environment that disrupt our hormones or our endocrine system. Poisoning our true mother, Mother Earth, poisons humanity and fertility for generations. So get the vaccine, which is safe, eat healthy organic food, to protect this generation and help stop climate change and environmental toxins to save future generations.
Thank you, Dr. Rohan. We have a question from our youth and young adults community.
Okay, and last question for the youth and young adults community. How do we get to the goal for community or herd immunity?
When enough people are protected from COVID-19 through vaccination, the virus will not be able to spread easily from person to person, and society can more safely reopen. It varies for different diseases, roughly between 70% or 90% of people infected, so it can't get a foothold and lead to outbreaks. This is called community immunity, or sometimes herd immunity. But we're people, not animals. So let's focus on the community benefits and motivations to get vaccinated. You can't spell the word community or immunity without unity. There is unity in immunity and community, and we have to protect those who may not be able to get the vaccine, like newborns or people who have severe allergies to vaccines. The quicker we get more people immunized, the sooner we'll be able to safely return to a normal life. We're in this together, and we'll get out of it faster if we all get vaccinated together